I chose to do common sexually transmitted diseases. The first one is going to be HPV. This is the most common sexually transmitted disease. This can be transmitted through genital contact without intercourse, and this can also produce genital warts and in some cases lead to cervical cancer. There is a vaccine that is available to prevent some kinds of HPV, and this vaccine is routinely administered to girls 11 to 12 years old. The next one is going to be STI. This is an infection in the vagina or penis, which is caused by a parasite. Most people that have this do not know they're infected. In the United States, about 3.7 billion people have this infection, but 30% of these people are the ones that have the symptoms, and which, in that case, they know they have the infection. You can get this infection during sex, and in women, the most commonly infected part of the body is the lower genital tract, and in men, the most commonly infected body part is the inside of the penis. The next one is going to be chlamydia. This is a common STD that can infect both men and women. It can cause serious and permanent damage to women's reproductive system, making it difficult or impossible for her to get pregnant later on. And this is obviously transmitted during sexual intercourse. And also, the last one is going to be AIDS. The human virus is a retrovirus that infects cells of the immune system, destroying or impairing their function. The most advanced stage of HIV infection is acquired immunodeficiency syndrome, and it can take 10 to 15 years for an HIV-infected person to develop AIDS. There is currently no cure, but there is treatment that does help the body function while having this virus. And HIV is transmitted through unprotected sexual intercourse, transfusion of the contaminated blood, sharing of contaminated blood, needles, and between a mother and her infant during pregnancy, childbirth, and breastfeeding. So this can be transmitted, obviously, in other ways besides just intercourse. And these are my sites.